Welcome back to Behind the Headlines. Rural health departments across Missouri are in a quandary about future federal funding that they rely on to provide affordable care. Tadeo Ruiz Sandoval with the NPR station in Columbia was first to report this, and he joins us now. Welcome back, Tadeo. It's good to see you.
It's great to see you too again.
Okay, so first, this is Title X funding. How much is the state expecting, and for how many clinics?
Well, the Missouri Family Health Council, which is the state's sole Title X grantee, was expecting $8.5 million from year 4 of a 5-year grant. But the U.S. Department of Health and Human Services temporarily withheld these millions of dollars that were destined to be distributed to 52 clinic sites within our state. HHS said the decision came out of potential compliance issues surrounding diversity, equity, and inclusion initiatives.
So, as you pointed out in your article, that county health departments, particularly the smaller ones, are often the primary medical care providers. So what options do they think they have?
Well, options vary from county to county. So some health departments, like the one in New Madrid, told me that operations would continue uninterrupted as they wait to see what happens with the funding. Other health departments, though, aren't as lucky. Zachary Moser with the Dent County Health Department Administration in Southeast Missouri, for example, told me that they have to consider charging patients for healthcare procedures that was previously free for low-income earners. And for some health departments, like the one in Pemiscot County, losing access to Title X funding would make it harder to hire staff, like nurse practitioners, which the grant helps fund.
So how do they use this Title X money? Give us some examples.
Yeah, so Title X funding goes towards reproductive health care. That means that we are talking about pap smear tests and other sexually transmitted disease care. The funding also goes towards providing contraceptives and even covering cancer screenings. And like I mentioned before, Title X can also help subsidize salaries for staff who work on reproductive care cases and materials that different clinics might need to provide care.
So is there an estimate or a head count on how many low-income patients and their health would likely be affected by this?
Yeah, I mean, Title X works with a sliding scale method that measures how much a person will have to pay based on how much they earn. And with that in mind, last year, nearly 44,000 patients received care through Title X funding in the state. Nationally, you're looking at a number of nearly 4 million people. And the experts that I spoke with were worried that those folks might forego their reproductive health care altogether if they feel like their wallet can't handle the cost. Also, earlier this week, The Right Time, a project that's led by the Missouri Family Health Council, released a survey of 1,000 Missouri residents aged 18 to 35 years old that found that 37% of respondents felt birth control will become harder to access in the future.
Okay, and today you zeroed in on OCAC, which is based here in Springfield. Has this changed the services they provide, or are they already thinking this will change the services they provide?
Well, for perspective, nearly half of OCAC's budget comes from Title X funding, and over half of the patients that they see are uninsured, which leaves the organization particularly vulnerable from Title X being withheld. However, OCAC's executive director, Jamie Robb, told me that they'll remain open and they'll continue to see patients who need reproductive care. She also said that anyone with questions about Title X should call their local clinics to learn more, and they're hosting an event at their headquarters on Thursday, May 1st of this year to talk more about Title X and its future. And as for where this story goes next, the Missouri Family Health Council submitted a formal response to Health and Human Services on April 10th, where they made their case to the federal government about the services that they provide in hopes of regaining access to the funding.
All right, we will see where this goes. Thank you for joining us today, Ruiz Sandoval with NPR in Columbia. You can see his reports on NPR stations across Missouri, also in the Midwest Newsroom and online, as well as this story and report on KY3.com, our KY3 News app, and Roku, Fire TV, and Apple TV+. Today, we look forward to next time. Thank you for joining us again.
Thank you very much. Until next time.
All right.